the type of capitalism we have in this country is structured, will we ever be able to have affordable health care?
There was universal childcare when the soldiers were out to war.
Why isn't healthcare a priority in the United States of America?
They're a business, a conglomerate.
Who are behind these organizations?
Because when
We
it comes time to respond in those town halls, we need to know how to ask the right questions.
That's it. Certainly, some people have ideological differences, but for the most part, I think a lot of people understand that there needs to be a change. So, Dr. Triss, I did some digging because I wanted to find out more.
You tout wanting to have better public health, yet there is a way that you could potentially get there, and you stand in the way of that.
Because when you pull the veil back from some of these professional organizations in healthcare, you would be surprised who's funding them. So many people would ask the question, why does the wealthiest country in the entire world have such horrible healthcare system? And when we say horrible, we're talking about not the potential of the healthcare system, but the actual function of the healthcare system, how much we spend on healthcare and how well we are doing when it comes to outcomes. So typically when we are assessing how effective a healthcare system is, we're looking at how affordable it is, how well we're doing with some of our major outcomes. And the United States, while we spend 2 to 3 times other countries, we have some of the worst outcomes when it comes to healthcare. On this particular platform, we have specifically spoken about the poor outcome when it comes to maternal health. I want to remind those who are watching, we thank you guys for joining us today. And if you have not done so already, we ask that you click that subscribe button because we have a lot to share with you today. And we want to make sure that you have access not just to the information we share today, but every other video that we post, because we lay down all the rules and bring you all the facts, honey. So make sure you don't miss out. We thank you guys for joining us, and let's just jump into this topic. Now the question we're asking is, why does it seem like it makes sense to most people? Certainly, some people have ideological differences, but for the most part, I think a lot of people understand that there needs to be a change. And part of the decision or conversation has been another push towards universal healthcare. Now, I say another push is because, Dr. Trissa, we had multiple attempts to
Yes.
obtain a universal healthcare in the past, but have encountered some of the blockades. And most people will be surprised that some of the organizations that we think are allies in the healthcare space have actually promoted and been forms of resistance against universal healthcare. So one
Yes.
of the organizations that has been criticized the most, and surprisingly so, is the American Medical Association. Now, the American Medical Association has been very pivotal in a lot of really major healthcare changes. But one of the biggest criticism and ongoing criticism is its stance against universal healthcare. So a lot of people will be surprised to learn about that. What did you think when you first found out that the American Medical Association, known as the AMA, had such a historical stance and actually was, I would say, the driving force against some of the earlier attempts to
Right.
start universal health
So
care?
in looking back and doing some of the research on the AMA, looking back, it could have been as early as in the 1940s. And I
Mm-hmm.
don't remember whose government was trying to get that established. In some terms, he might be considered a progressive Republican, whatever they want to call it. But the point
Right.
is, they were trying to establish then, and they were the biggest deterrents, the AMA, and got together with a few other companies. And right now, the names are, I'm lost in the names.
Mm-hmm.
I'll find them later and mention them, but um, to put out a campaign to turn the hearts of the people against having universal health care. So they succeeded in that time and they established this private insurance schema that we currently have. And that's been burgeoning for a while. And
Yeah.
more recently, we keep having more and more talks on in different election cycles and everything else, but we're still having that same kind of conversation. Looking up now, they are, yes, supporting the Affordable Care Act and expansions on this, but that is very different from a universal healthcare system. And it's really disappointing to think that you tout wanting to have better public health, yet there is a way that you could potentially get there, and you stand in the way of that.
Right. And what's really interesting is that the Affordable Care Act initially, or in its most original form, had a public option. And the
Mm,
Republicans voted against that public option. And so I always try to remind people when they criticize the ACA and say, well, it made things expensive. Well, there were certainly a number of things that happened that led to the high premiums that we pay now. And part of that was the fact that there was a vote against the public option. And
yes.
had we had a public option, that would have made healthcare much more affordable for millions of Americans, especially those who fall below the poverty line in America. The other thing is that the president we have currently also made some changes that led to the increase in premiums. So when you take away the federal requirement to have healthcare, that also de-incentivized
Mhm.
individuals from obtaining healthcare. And certainly there are certain states that still have some penalties with regards to having healthcare. But in terms of it being a federal penalty, that no longer exists.
Mhm.
And when you remove the penalty, while people do have issues ideologically about requiring a compulsory requirement for healthcare, just looking at it from a financial aspect, if you have no penalty, what's going to make people pay to have healthcare, especially since there's such a lack of control of the health insurance industry.
Mhm.
And so people are looking at high premiums and they got to pay other bills that are more
Mhm.
important. So
Mhm.
a lot of people dropped out of health insurance as a result of that, which then when you have fewer people in the pool, then in order for health insurance to make their tremendous
Profit.
profits that they make
Mhm.
annually, they have to increase, or they don't have to, but what they do is they increase the premium so that you pay for their decrease in insurees. So in order to compensate for their loss of the insured, they increase the premiums. And so a lot of us were paying much higher premiums than we expected with the idea or the original idea of the Affordable Care Act. So that was definitely one issue. But going back to what you were mentioning, Dr. Trissa, it really surprised me
Mhm.
because when you think of these professional organizations, you really think of them, at least I did, from almost a purist perspective, not saying that
Mhm.
everyone's perfect, but
Mhm.
thinking that as clinicians, because I assume most physicians enter these and clinicians in general, we enter medicine because we have an earnest desire to care for the sick, to help the sick, and to help those who are in need. And
Mhm.
so any type of policy that allows us to be able to do that, I think is one that we can, for the most part, agree on. Now, I'm not saying that clinicians are monolithic.
Right.
We definitely have diversity of
Correct.
opinions when it comes to healthcare. But for me, I really just thought that the American Medical Association would be one of those organizations that would be a supporter of universal healthcare. So it really was disheartening to find not only were they opponents to it, but they actively advertised,
Rallied against it.
promoted, had a
Rallied
main
against it
rally.
actively.
Exactly.
Mhm.
Exactly. They poured
Mhm.
funding into this very effective campaign. And
Mhm.
then also are responsible for the privatization of healthcare systems that we have now. So, Dr. Triss, I did some digging because I wanted to find out more who are behind these organizations, right?
Mhm.
And when I tell you, I am so disappointed, so really disappointed. And it leads me to ask the question, the way our healthcare system is structured, the way our economy is structured, the way the type of capitalism we have in this country is structured, will we ever be able to have affordable healthcare? Because when you pull the veil back from some of these professional organizations in healthcare, you would be surprised who's funding them. And now it actually makes sense why some individuals are so not trusting of the medical field in general,
Hmm.
because they are aware of these fundings and
Hmm.
these conflicts of interest, right?
Hmm.
So how do you feel about the fact that, for example, a lot of these major organizations have a lot of big pharma funding them?
It leads me to think that they will not do anything to disrupt their, it's not stakeholders, it's not shareholders.
Donors,
Buddies, I guess is the best.
investors.
There we go.
Yeah,
They're
they
not
may
going to
not
do
be
anything.
intended to invest, but we
Right,
all know they're not
right.
giving these millions of dollars for
For
free.
nothing.
Right.
So they're not going to do anything to upset them. So they're not really a pro consumer, pro
Mm-hmm.
patient
Mm-hmm.
environment. They're a business, a conglomerate, just like many of the things are at this point in time. And that becomes very disappointing to say, but this is where you have to start just being a bit more diligent and I guess being a bit more aware because that
Mm-hmm.
awareness will bring a level of understanding that you're not running around banging your head against walls, trying to open doors
Right.
that are actually walls and are not going to come down. You have to
Right.
take your fight in a more strategic way, in a more
That part.
strategic position, right? So it's really just as disappointing to hear. And don't get me wrong, I guess like anything else, they have to have funding, but funding for what? What exactly are we getting funding for? What are you doing?
Right. So they're supposed to be lobbying, right? But now I'm questioning the motivations behind what policies are lobbied for.
Mm,
They're supposed to be keeping us updated with for example, the Journal of the American Medical Association is one that I refer to a lot because it's just an excellent body of
hmm.
peer-reviewed publications.
Hmm.
And the main organization, the AMA, does get most of its funding through or income through the intellectual property for the CPT. So our procedural codes is actually intellectual property for the AMA, and they get money through those astronomical membership fees
Hmm.
that we are all paying. But it leads me to ask the question, realistically speaking,
Hmm.
we need these organizations? Yes, we need some body, some body of individuals that will keep us updated because our lives are very busy, right? Dr. Trace, our
Right,
lives are busy.
right,
And
right.
so for the most part, I don't have time to independently go look into the latest research. So I like to get that ding on my phone that tells me
Hmm.
that there's a new research that's updated in relationship to stuff that I would be interested in.
Right, right.
At the same time, I would love for these organizations to truly represent us. And maybe they are representing some clinicians who do understand and support their stance, but I certainly don't. And I definitely would say I would think that they would try to detach themselves as much as they can. But the problem is these corporations are the in most profitable corporations in the United States. Big pharma
Drug
is big money,
manufacturers. Hmm.
right? And the health insurance companies are big money. And so
Hmm.
when you're looking for funding and you're looking for corporations that have a vested interest in healthcare, it's you're going to encounter big pharma, you're going to encounter the health plans. And so
Hmm.
then how do you sustain the cost of running your organization, of lobbying, of the administrative costs? Because part of the 2 to 3 times cost of healthcare that we have in America is due to administrative costs. as
Mm-hmm.
opposed to direct patient care. And
Mm-hmm.
so, how do they cover these costs? I mean, I definitely say every time I pay for my professional dues, that I'm paying for somebody's real estate because they got
Get
better.
it.
Listen,
Mm-hmm.
those administrators got better offices than I do. Okay.
Mm-hmm. Mm-hmm.
And so is it feasible? Is it unrealistic to ask them to sort of detach themselves from these organizations? And I'm sure that they swear that there is no conflict of interest. A lot of
Mm-hmm.
the major corporations that we saw are part of the AMA, are sponsors for the AMA Foundation,
Mm-hmm.
which is also makes it even more of a conflict if you ask me. But is it realistic? Are we asking too much of these organizations to not accept these particular donors or donations?
I know their office has to run,
Mm-hmm.
but I don't think they need to be running at such premiums. I feel like they're stepping into the level of not just necessities but luxuries. But you're taking a necessity from people and categorizing it as a luxury.
Why isn't healthcare more of a concern for Americans? Like, why aren't Americans as a whole, and when I say as a whole, I mean not just the individual, but all the way from the individual to the corporations, why isn't healthcare a priority in the United States of America?
Because it's individualism. That's the only thing I can think about. It's our
Mm-hmm.
individual thing. A lot of the times we think of healthcare, and we're just thinking of it as being me, 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 me. There's a very, very individualistic society that we live in. It's all about our what we want for us and maybe for our small family, whatever. We don't look at a collective. We don't necessarily look at the group. We're not looking at other people as a whole, a neighborhood, a community, and that's very typical of the region. So there's not the understanding of it's not just my health, it's our health. Like it's hard for
Mm-hmm.
you to be healthy in an environment that's not healthy, and that's
Mm-hmm.
environmentally, socially, and all of these
Mm-hmm.
other things. So I think for us, it's so much of a individualistic thing that everybody gets to have their own desire and their own free will as to how things are done. But within that, we don't quite get that there's a need for the care.
Mm-hmm. Mm-hmm.
I feel like in more communal societies, they may not have great access, but there's still an understanding of like a care for those around. And so if they had better access, they might have a little bit better care in that community, not just of this one person while everybody else around them suffers, but as a community, they could be healthier and they could be better and do better.
Mm-hmm. Mm-hmm.
But
But
here, it's
mhm.
just too very individualized. Everything is just me, me, me.
But given the fact that America is such a system that runs in capitalism, right? Which
Hmm.
I guess paves the way for that type of perspective,
Hmm.
um, it's not working, right? If we are about profit, then our government is spending so much more than other governments that are smaller economies, but
Hmm.
also very much based on capitalism as well. And I think
Hmm.
part of the issue, I agree with you that I think capitalism does kind of foster that type of individualistic
Hmm.
perspective because it does make you feel like crabs in a barrel. Like to make the or to meet the American dream, you have to kind of beat out the next person because there's
Hmm.
only a select few that's going to rise to the top, right?
Hmm.
The cream of the crop, which is one of our very older sayings that kind of gives you that mindset, right? That
Hmm.
there's only a select few that's going to ultimately rise to the top.
Hmm.
And so when you have a system based on capitalism, your focus oftentimes is profit. But then you
Hmm.
have other society that are very much societies that are based on capitalism, like UK and Canada, that have universal healthcare systems. And actually, when you look at the best healthcare systems in the world, you find that the top healthcare systems in the countries, the top countries or the countries with the top healthcare systems
Yep.
are those that have typically some type of universal healthcare. Now, granted, whenever you say universal healthcare, it's like, people have conniptions because
Mhm.
they,
Mhm.
they hear universal healthcare and they automatically think socialism, communism, where are we going?
Mhm. Mhm.
But
Mhm.
there are very successful, well, more successful than the US for sure.
Mhm.
They definitely do have some pitfalls, but they are still doing way better than the US when it comes to outcomes and the cost of healthcare. People are
Mhm.
not spending large percentage of their income to receive the basic access to healthcare.
Mhm.
And so you have systems that are varied. So not every universal healthcare or universal access to healthcare is the same. So you
Right.
have systems like the UK where the government pays for the clinicians and pay for and everyone's paycheck comes from the government that's in healthcare versus where you have in Canada where you have universal access, but you
Mhm.
also have an element of privatization where the providers and the hospitals are private. So you have one system that has universal access, but the government actually does pay for the hospitals and funds the clinicians.
Mhm.
And then you have one that is universal healthcare where they do more of a hybrid. And there are
Mhm.
a number
Mhm.
of other countries that have different types of systems or setups for their universal access. But nonetheless, I say that to say that it behooves us to it really is up to us, because I don't remember if I used that in the right context. So I was like, wait. When you've been reading that King James too long, then you start using words,
Mhm.
you're like,
Thou, thy, then, thou, thus.
I beseech you, my
I
dear
be-
brethren. Maybe I will use the word, I beseech you, my dear brethren. Have a moment of Selah
Mhm.
and really consider the fact that we can be creative in how we set up our universal access, which I
Mhm.
think was the attempt of the Affordable Care Act.
Right,
I think
right,
that was our attempt of introducing that particular idea, but it got so much pushback again because people are just hearing these terms and not really understanding what they actually mean, or
right.
the fact that you can have a capitalistic society, you can have a democratic society as countries that are social democracies, right? So they have socialism, but they also blend it with elements of democracy. You can have a variety of systems that are hybrids and still be able to create a system where every individual is able to have access to healthcare, which we all agree is a base. Well, maybe we don't all agree. Maybe that's the problem. We
That's
don't all
probably
agree
where it
that healthcare should
starts.
be a basic human right, but I would like to think the majority of Americans believe that.
There's
Um,
still so much, I think, of the there's still so much of the I should have it when you are palm colored, but when you
right.
anything other than palm colored, you shouldn't.
That part. That's exactly what it is. That's exactly what the underlying messaging is.
Correct.
And you're absolutely right. There are people who don't believe that some of us should have access to healthcare or should have
Correct.
access to anything
To
that is a
anything.
human right because they don't consider us to be humans. They consider
Hmm.
us to be less than human. So you're right.
Hmm.
Thank you for that correction. Thank you very much.
Hmm.
And on that note, also, when we look at the corporations, the way our system is built, and when you look into the corporations, whether it's with the pushback and all of the lobbying that they do, all of the paid campaigning against universal health care, and then you dig a little deeper, you go down the rabbit hole like I did, and you find out the impact or their efforts of certain corporations against
Hmm.
maternity leave so that
Hmm.
their
Hmm.
formulas can
Hmm.
be
Hmm.
sold more.
Hmm.
And then you
But
look
yet,
at
but
the
yet, there was universal childcare when the soldiers were out to war and they needed women to come work. And then all of a sudden, we cannot do universal childcare anymore. Yes.
that part, okay? Like we see y'all, and then even finding out about the push against or sort of messaging against potty training and the corporations behind the campaigns of
Mm.
doing later potty training so
Mm,
that you are more likely to buy diapers for longer. There is so much going on. So we have a system where corporations have been able to earn so much money um,
hmm.
that they have been able to pretty much control so many aspects of our lives.
Right.
Even when we almost unanimously, in some cases, or majority, have a certain perspective that is different from them. And so the part that I think hurts me the most is we don't do enough digging to find out, we don't pull the veil back enough in the United States to really find out who's behind everything. So I
Hmm.
say that, Dr. Trista, because one of the things that I recently learned was one of the most controversial decisions occurred recently with Congress when we have senators, congressmen and women who decided to vote to end the shutdown, end the government shutdown, while we are definitely empathetic with all those who have been negatively impacted by the loss of income
Hmm. Hmm.
and the loss of safety. Definitely, I would say the Democrats were trying to make a statement and trying to really add pressure with one particular goal. And that goal was to ensure that Americans would not lose their healthcare plans come January. Because with the loss of the ACA subsidies,
Hmm.
the premiums already, the estimates that people are receiving are already 2 and 3 times what they're currently paying, which for some people is going to mean a loss of insurance, a loss of health insurance. And a
Hmm.
loss of health insurance or loss of access for individuals who have conditions that are life-threatening conditions can actually be life-threatening. So I think
Life
the
ending.
estimate was the loss of insurance or health insurance can lead to, don't quote me on this, but I believe it's 50 something thousand deaths per year from the loss of health insurance. So this is very much a life or death conversation that needs
Hmm.
to be
Hmm.
had. But, when you pull the veil back of those individuals who decided to vote in alignment with the Republicans and cross the aisle, for Democrats, and this is not a conversation about whether you should be Democrat or Republican, we're just using this as an example. When you pull the veil back of those particular senators for people who are asking why would they break ranks, and granted, you've heard the speeches, you've heard the convincing arguments of, being empathetic towards people who have lost income, especially our Navy, our soldiers, our heroes, not having access to food. And definitely one of the most heartbreaking things, because I am a supporter of vets. I'm supportive of heroes. I'm supportive of our military, 1000% 10 toes down for them. And so seeing them on lines at food banks is a very disheartening of image for
Thought
me. It's
image.
a
Hmm.
very disheartening image to see,
Hmm.
as well as the single moms and just everyone, the
Hmm.
most vulnerable, right?
Hmm. Hmm.
And so you would want to believe these convincing arguments that that really was the motivation. But when you unpeel the veil, Dr. Trista, when you pull that veil back, Dr. Trista, and you start to see who's funding these senators,
Yeah. Yep.
it really makes you question whether or not this particular move was really a genuine and authentic desire to help those who were suffering. Because a lot of them, not all of them, but the majority of them, are very heavily funded by
Hmm.
two interesting industries.
Hmm.
The
Hmm.
healthcare industry, looking
Hmm.
at specifically health plans, health
Hmm.
insurances, are
Hmm.
funding a lot of them.
Hmm.
And then also the airlines,
Airline.
right?
Hmm.
The two big industries that are vested in people going back to work. And
Hmm.
granted, shout out to our FAA and
Hmm.
our controllers out there.
Yes.
We definitely did not want to see TSA controllers, all the people we appreciate, all the hard work
Yes.
that they do. We didn't
Yes.
want to see them suffering.
Nope.
This, however, I would definitely say there are individuals who were furloughed, who were very much 10 toes down to
Hmm.
apply pressure for the saving of healthcare for individuals who are the most vulnerable. So the elderly,
Right.
the kids, a lot of kids are on these plans that are
Right.
risk for losing these plans, and certainly those who are otherwise abled. So a lot of people that they said that they were looking out for actually understood the movement and actually understood why Democrats were doing what they were doing. And so there are a lot of people who did not have access to food, who did not have a paycheck coming in, who said, no, I want y'all to hold the
The
line.
line.
And
Yeah.
so to see these individuals make that decision was this already disheartening for them. It was
Hmm.
already disheartening to see them, to see that they were already making such major sacrifices and they didn't get anything in return but a promise. Listen,
From an unreliable, untrustworthy group.
exactly. It's like that dude that gives you a promise ring that ain't never was accountable for anything.
They keep
Right?
moving the line. They tell
Y'all
you
know
this
how
is
we
where the
feel
line
about
is.
that,
They tell
right?
you this is where the line is. If you make it here, we will help. And as soon as you're about to get it, they get to the next, they move the line again. They're
Right.
consistently moving the line of where you
Yes.
need to get to be acceptable, to be right, to be good, to be helped, to be whatever.
Yes. Yeah,
And this
no,
is
you're absolutely right. You are absolutely,
this is
absolutely
who we have
right.
a promise from. We have a line to
We
meet
have a
for them there.
promise.
Yeah.
We basically gave the Democrats gave the Republicans, no, sorry, the Republicans gave these Democrats a promise ring. A promise ring.
And it wasn't even gold. It was the cheap tarnished one they got
And
from
they have been
the
cheating
Jersey
on
Shore.
them forever. But they gave them a promise ring. So it really now when you add to that conversation the fact
Mhm.
that they a lot of these senators, or it's not a lot, it's eight of them, but the majority of the eight of them are heavily funded by industries and corporations that have an interest in the government reopening, that have an interest in airline workers returning to work and not calling out because they're driving Uber to be able to feed their families. They have an interest in making sure that those health care premiums go up next year, right? That those health insurance premiums go up next year. And because they have a vested interest in that, were they influential in these decisions, in the decisions of these senators to cross the line? So that's what we're talking about, right? We're talking about whether it's on the Democrat side or whether it's on the Republican side, but really across the board, when you have individuals or organizations in leadership that are instrumental in policies,
Hmm.
instrumental in decision making that affect your daily life, it
Hmm.
really is up to us. I beseech you, dear brethren,
I
to
beseech you.
really pull that veil back and be more proactive about finding out who's really behind the decisions that are happening, that are taking place, that are leading to policies and moves within the government that is responsible for your daily life.
Hmm. We got to do better because when
We
it comes time to respond in those town halls, we need to know how to ask the right questions.
That's it. That's it, Dr. Trissa.
Ask the
That's
right
it.
questions because we may not have any influence on the AMA,
Right, right.
but
Oh,
we
maybe
do
we do
have some.
as members.
Well,
Maybe
as members, yes, but the regular Joe Schmo won't have that
they
kind of
don't.
power. But
Yeah.
as a voter, you want to put that pressure. You want to show up. You want to ask the questions. You want to be there and get people thinking. You want to
Right,
get the information out. You want to make
right,
sure that they can, if they're gonna do it, stand 10 toes down. You know what I'm saying?
right, right, right,
With your
right,
whole chest, come out and do what you're doing,
right.
not whatever and trying to ply it over and none of that.
Yes, and there are organizations that are starting to make very critical. There are organizations that are starting to make historical moves. And an example of that would be the American College of OBGYN, not because I'm biased, but I really am, but I'm going to share why. I'm going to explain why. Because they, with all of the barriers and setbacks that have been happening when it comes to women's health, they made the decision to decline any additional federal funding to the organization from this particular administration that has been
Hmm.
so very anti WOMEN in their policies. And
Hmm.
so That is an example, and yes, the ACOG is not fully cleansed. You know, ACOG
Hmm.
does receive some corporate funding from some interesting big pharma and plans, not a lot, but they're there, and there's
Hmm.
still room for continued cleansing. But I like the fact that they're starting to take those steps, and I like the
Hmm.
fact that we're seeing the American Association of Pediatrics that's also been coming out. They still have significant funding, but they are starting to make shifts and moves that that cause them to pull out policies that says, "Hey, the administration says this, but this is what we said." So
Hmm.
there are the organizations are starting to make some bold moves, but we want to see more. We want to
Yes.
see a cleansing of that and a complete detachment of these big funders. And I don't know who would fill the gap, but we can figure that out, right? We're creative beings. If we're in the professional organizations, that means we're smart enough to
Mm-hmm.
come up with ways of getting funding, right? Or
Hmm.
trimming the fat so that I don't mean to sound like anyway, trimming
Hmm.
the fat so that so that we can be more effective. But I want to see more of those bold moves. I want to see more of those moves that make us feel like, yeah, you're kind of representing us. That's what
Right.
we're looking for. Because the
Right.
American public, I would definitely say, have made very clear certain goals and certain initiatives and certain things that are priority. It's just that those who have been in power have not been listening. So,
Right.
what I would say to America, if I had to say anything at all, is that hold on, America, hold on. Okay, because I got to be able to see y'all.
I beseech you,
I
brethren.
beseech you there, brethren. This is your big sister talking, America. And if I had to say one thing, I would definitely say that we haven't quite understood our power as the collective, right?
Hmm.
And so these corporations are not powerful unless we are paying them, unless we're utilizing them, right? These billionaires that are out there that are behind a lot of the things that we're seeing and a lot of the shifts and changes that we're experiencing, the only reason why they're billionaires is because they're business people, which
Hmm.
means they required our coins to be able to be wealthy. And so
True.
I said it at the top of the year, and it has held through all year. We need to be more conscious consumers, and we
Hmm.
need to do the hard work to find out who is lobbying what on Capitol
Hmm.
Hill, right? Looking
Hmm.
up these corporations and finding out what are they lobbying,
Hmm.
who's behind certain policies that we all agree on. You know, a lot of Americans are for universal daycare, right? Or for
Hmm.
daycare access. So
Hmm.
who's really behind why we haven't been able to get that passed?
Hmm.
Who's behind why we haven't been able to get paid maternity and paternity leave? So understanding that it is up to us to peel the curtain back, look into who's countering the things that we desire. Because
Hmm.
if they are places where we typically shop at, it's perhaps time for us to stop shopping there. It's perhaps time for us to stop patronizing certain businesses that are against us. Why would you pay into a corporation that is against something that you fundamentally believe? It doesn't make sense. And a lot of times it's not very obvious. So you won't necessarily see them outwardly campaigning. A lot of times they do stuff behind other fake names,
Hmm.
but we can find out that information. And when we do, we have to make that hard decision. I know they may be the only uh, company that's nearby in the neighborhood. You may have to travel a little bit further, but we have to make those hard decisions if we truly want to see change in this company.
Right.
Sorry, in this country.
Country. Yeah, it's a company. That's what they're running it like. It's a company.
Yes, they are.
And I
They
mean,
run
he
America
bankrupted
like it's
all
a
of those
company
in the
for them.
past, so he's gonna probably bankrupt this one if we give him a chance.
Exactly, exactly. But
Mm.
we still have that power. And that's what I want us to believe and to believe in our hearts, not just through our mouths, but believe in our hearts that we have the power as a collective in America. We, not unanimously, because we are not
Monoliths.
monolithic. We are very much a diversity of opinions,
Mhm.
but there are certain things that as Americans we believe as a majority. And if we believe certain things as a majority, then we can shift that pendulum into the direction because we are more powerful in numbers. And so I
Right.
really want to see us as Americans making better conscious decisions and not just falling for the glitz and the glamour of the next gadget that comes out because we want to be that family that has the gadget because we want to be somewhat elitist and we hold on to
It.
these elite products
Hmm.
to make us feel like we're the exceptions, like we're above other people. That's the same ideology that got us where we are. So
Right.
it's important for us to make that difference. What would you say to Americans according to the book of Dr. Trissa?
Well, since we're talking about healthcare, I'm going to make it very specific to healthcare. Um, we may want to look at more collective, group-based funding for our healthcare.
Oh,
Self-paying, but in the area where I am, where it's a whole lot of Amish people,
mm-hmm.
they don't use your health insurance. They pay because they have a bank for collective community care for healthcare. These are some of the things that we may have to look into for ourselves.
I love it. I love it. It sounds like such a radical idea in our current norms, but it's really not. That's how our
Mhm,
communities started. That's how our
mhm,
communities fostered, right? We were
mhm.
very much self-sufficient, but they then destroyed a lot of our communities.
They
But
sure did.
they
Mhm,
sure did, but that's how we all started. And it is systems like that that are successful, that are efficient, and that help us to get better outcomes. And that's really the goal, right? Is to make it affordable,
mhm.
accessible, and to allow us to be able to create systems where we have better outcomes. All right. We have given you the playbook, okay? Now that we have given you all the playbook, Dr. Trissa, where can they tap into your knowledge of and understanding of the healthcare system or where we should be going as Americans?
TrissaJob.dpt on Instagram.
Love it. And I am Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube, your favorite home, and Healthy Bump Club on Instagram. We thank you guys for joining us. And if you want to find out more about the overall government system and have a better understanding of socialism versus communism versus capitalism and the pluses and minuses of all, tap into the last video. Make sure you all check that out. And we thank
Mm.
you guys for joining us. And we hope to see y'all when the next
Next episode.
episode. Ew. This is Dr. T. Just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.